welcome back to the Senior Hour. I'm Dr. Gene Dorio with my co-host, Barbara Cochran, on your hometown station, AM 1220 KHTS. We're talking with the dabbling, Dr. Thomas Polucki. But, the dabbling part, I think dabbling is kind of important because when patients come in to see you, you want to know, okay, an important part is what do they do for a living? But the other side of the coin, how do they think? How are they thinking about their illness? And that's one of the things that I think we need to clarify with our listeners. That does play a role. Right. And I feel if your medical professional doesn't ask you that question, some questions concerning that, they're out in left field with trying to give you care.
Exactly.
And they should. That aspect of the role that the psychology plays in what we're doing. And you mentioned the PET scans, and we have fMRIs, functional MRIs, which the MRI is a photo of the brain, whereas the fMRI, functional MRI, is the video of the brain. And so same with the PET scan. Yeah. So we're seeing not only the functionality and the physical part, but we're also seeing the what's going on in the brain and how the neuroreceptors and transmitters are acting. And by knowing that, then our research will be better honed to taking care of our patients. So you ask questions when they come in. What are the things that you think are important that our, especially our seniors listeners, should be mentioning to their doctors about their life and their quality of life that may have brought them in?
Right. Well, the key is asking questions. And unfortunately, all doctors, medical doctors, any kind of alternative doctor, chiropractor, we are under a crunch right now. We are getting paid less and less, required to do more and more things that absolutely do not benefit the patient. And it's a game of how can I be a good doctor and satisfy all the requirements in order to get paid anymore? And this is a very real consideration. People think that, doctors make so much money that none of this matters, and this just seems like an assembly line. And there's a reason that things have changed dramatically within my lifetime in the field of medicine. It's that this is the machinery of healthcare in this country has gotten to the point where most people, anybody who can afford it, is opting out of that system completely, and they're looking for what's now known as a concierge doctor, which can be quite expensive, can be in the order of tens of thousands of dollars a year, so that you have a doctor that actually will sit down and talk with you, that will take your phone call at any time of the day, that has your health as the priority. Not what code do I have to use in order for this to be reimbursed by insurance, or am I to the point in my career where every patient that I take on is pro bono? Because there's a very good chance that if you don't do things exactly a certain way, you're not going to get paid. And this is
the public doesn't know that.
It's disturbing. It's a disturbing fact, and you want to. You can sense the frustration in the patient, and sometimes you can sense the frustration in the caregiver. But it's never explained why this situation is, and all of a sudden everybody's just throwing their hands up in hopelessness and helplessness, saying that I just don't know what to do.
And just in a nutshell, let me explain to our listeners, there's something called MacRA, M-A-C-R-A.
Yeah.
It's put out by the government, and it tells the physicians you have to do certain things in order to get paid a certain amount.
Yep.
So they made everybody jump for the carrot and fill in the boxes on their computer in order to not get their 2 or 3% decrease in pay. And the bottom line was that when everybody this past year submitted their information, almost everybody got rejected and lost 2 to 3%.
Yep.
So the whole idea is
I didn't
actually
even
just
bother with it.
Yeah, don't even bother with it.
It's just tying up more time that is never
The
going
loss
to be
to patient care at this point. And of course, many doctors in this country are trying to repeal that, and we'll see what happens with the new administration if some of that goes away. But I doubt it very much, because most of it is predicated on profit, which is not a problem to me, but it just depends on how much greed is associated with that profit.
Right.
And that's what's going on right now. It has subtracted out the time that is given by the medical professional in caring for their patient, and the patients, especially our senior patients, are feeling that in their 5 to 10 minute doctor visit.
Yeah. So the art of medicine, and when I use the word medicine, I use it in the old term, which means healing. Because now, unfortunately, medicine almost means exclusively prescription filling.
That's right.
So I'm not interested in that at all. First of all, that is not part of my license. I know you can do that, but I have to work towards getting people better. I don't have the luxury of listening for a few key buzzwords and writing out a prescription and saying, have this filled on your way out.
That's right. This will help you.
So I've been trained to listen and try to be as effective as possible, because I'm under the same time constraints as anybody else. I get paid much less for an insurance-based visit than any medical doctor does for any condition. If I do a thorough history, I'm getting about 10% as if a medical doctor would have run that exact same history.
That doesn't sound fair.
Well, it's not fair, but that's not the point. The point is, I've had to learn long before. Now it's starting to affect more and more medical doctors. So they're now trying to learn what I've learned over the past 25 years, is that you have to be very effective. You have to really listen closely, and you have to look for not so much the buzzwords to write a prescription, but really look for the type of communication that is coming out of that patient. Look for what my red flags aren't necessarily like, okay, is there cancer? Is there infection? Is there these things? That's old. I mean, that's not my most important thing. My most important thing is, how is this person talking to me? Are they talking in a way that they're not getting what they need in other places, and what is being missed by it? At what stage in that game are they? Are they concerned? Are they frustrated? Are they already into helplessness? Are they already into hopelessness? And those are the red flags that I look for, because the other stuff is just semantics. We have technologies that can deal with cancer. We have technologies that can deal with just about every one of the top 5 killers. We don't have great technologies to deal with a person who has given up or is in the process of giving up. So my red flag list is quite different than most doctors. And I've got to say, I've got to assess somebody in that same 5 minutes that any doctor has. I've got to know within a few minutes of watching their body posture, watching the way they communicate. And 80% of communication is not the words coming out of their mouth.
No, it is not.
It's their body language.
Absolutely.
Watching, are they open to the possibility? Are they hopeful? Are they really looking for something? Are they frustrated? Are they in the right place for me to start unlocking the possibilities for them? Because I know if I can get them on the table, I can give them a unique experience that they're not going to get, even with the heads of department at UCLA. No disrespect intended. They're just not going to get that. And I have the science to back it up. It's not my opinion. It's not like, oh, I think I'm God's gift. I'm not. I just take this real seriously, and I've done a lot of homework on trying to help people as much as I possibly can. And that's what it's all about as far as I'm concerned. So these next few weeks is the toughest time of the year for the overwhelming majority of people.
Absolutely.
And I already see it, and you see it across the board in so many businesses. And unless you're retail, where people are scrambling at the last minute to buy gifts that, just because they feel they're obligated to exchange gifts at this time of year because we're so conditioned to do that. Outside of that, most of healthcare takes a hit in this time of year. People are not necessarily thinking about their health, which is the most important asset they have. There's no return on investment like your health. None comes close. A good friend of all of ours is Arif. He is, as far as I'm concerned, the expert on finances in Santa Clarita, and he's made his whole business on giving people a guaranteed return on investment of 5%. Guaranteed. You can't lose money. You're going to gain 5%.
But if you're looking for 25% or 20%,
you don't talk to him.
Don't talk
to him. Yeah, because that's a risk. In the financial world, that is an absolute risk.
And to have that conservative approach and say, 5% is fine for me.
Right. Okay, now get this. So I don't know if you saw this, but the Surgeon General 6 years ago put out a comprehensive study on prevention. And what he found by watching workplace practices, what businesses, what corporations were employing wellness programs within their workplace, they were able to determine that every dollar spent on keeping people as healthy as possible instead of waiting for the illness or the injury saved a minimum of $3.27 in medical costs. So $1 immediately gives a 327% return on investment
Per year or per?
No, yeah.
Or
Not 5%, 327%.
That's
So
amazing.
you're talking about making $3 for every dollar that making $2.27 for every dollar that you spend. Okay, so that's not even the real benefit of this. What they also found was that beyond that, because that's just medical expenses, and some people don't consider that a real issue because they have a great insurance policy or whatever. They don't consider that the real issue. What they found was that every dollar spent not only saves $3.27 on future medical, they found that it saved as much as $9 extra on bottom line profit for the company. It produced $9 extra because people weren't showing up sick or distracted or have another family member who's sick or not being able to come into work at all or showing up and not really being able to produce the creativity or the production that a healthy individual would. A 12-to-1 return on investment for every dollar that these corporations spent on wellness and prevention for their workplace yielded them $12 in return.
So 6 years ago, how many companies heard this, Thomas, and implemented it?
I'm not aware of that. I
Yeah,
know
see,
that I
that's
never saw it on the news.
That's part of our problem.
I know that I had to go looking for this hard. This is not some abstract, bizarre, third world, ultra-liberal, study. This was the Surgeon General of the United States. This should have been headline news. Instead, everybody's talking about the Affordable Care Act or this or that or whatever. Forget about making healthcare more affordable. This makes healthcare pay.
Yeah.
This is what we need to be focusing on. Instead, you see the embedded commercials in the top stories about how this drug is going to change everything or that drug is going to change everything. And people are not aware that these are not real news. It's a commercial, a bought and paid for commercial to make sure that the people who don't want anything to change here isn't going to. And I know this sounds conspiracy. I hate talking in these terms, but the bottom line is, at a certain point, you've got to get disgusted. If you're not disgusted with what's going on, you're probably not going to change. You're not going to change anything about it. It's got to get to the point where you're on the edge of that cliff with the motorcycle revving and you decide, I am not going to go over the edge. I'm going to turn this around and start living. And for most people, that doesn't come soon enough.
All right. But what is it, do you think, especially with our seniors, what is it, and I see seniors giving up.
Yeah.
I see that happening. And, our hope.
Well, the whole system is designed to support that. You've published many articles about the death squads.
Mm-hmm. And, well, now the profit motive death squads that are out there, and, Sarah Palin once said it, but, nobody would believe that. And not that I support her or anything, but the fact was there is some truth in what I'm seeing at my level, and that's what sometimes, bothers me, that our seniors are facing this as well, and then getting to the point where they're at the edge as well, wanting to give up. They've lost that confidence. They've lost their spouse or a loved one, and their finances, the financial problems they're facing, their pet is gone, they're not driving anymore. All these things they're facing that puts them at the edge of the cliff. Then they have some physical problem. They go see their doctor. Oh yeah, your heart is, it's heartburn. It's not a heart attack. It's your arthritis, and it's the weather. These things start to affect people. But the other side of the coin is the psychological impact that life is having on them as well. We are ignoring that. And you mentioned the Surgeon General on wellness and prevention. Well, if we were to practice that a little bit more generally in medicine with all the medical professionals, spending time to ask our patients the appropriate questions, we would save a lot of money doing that. But we don't want to do that because the commercials go on, it pays for the media, it does all these things that we look at and say, oh my goodness, we're going to allow them to control where we're going, what we're doing, and how we're doing it. And because that continues to happen, our healthcare is going to deteriorate. And
Absolutely.
That's essentially what I have written about, and many other people have written about also.
Absolutely. So the easiest answer is, if you're a conventional medical doctor, you're going to have that 5 minutes to figure out how to do a reimbursable code.
That's it.
No offense.
That's all they're thinking about.
You got this 5 minutes to figure out what code can I put on this condition that is going to get me paid. So that's a little bit disturbing, but that is the unfortunate reality.
And let me just mention, while you're on that topic, at the hospital, you have to put those codes down.
Yeah.
And they have now a group of professionals telling us what codes that would be supported in our information, but translating it into those codes. And here's the best part. If you don't substantiate it, then you can be kicked off of medical staff.
Exactly.
So you're not treating the patient, you're now doing things for hospital, insurance companies, all these folks to make their money, and have their data so they can put it in there and wave their banner and say, look what great things we are doing.
Absolutely. So, for good or for bad, 25 years ago, I made a choice not to play into that system. Mm-hmm. I did have the foresight of where things were going because, well, I'm not going to get into that. It's not about me. But what I have had to learn in the past 25 years is how to get the results without any of that drama. And what it has come to is that on a one-on-one basis, it's almost impossible to impart the information that needs to be imparted. It's one of the main reasons I have my radio show. It's one of the main reasons I'm here once a month, to try to get this information out there. Because if I had this conversation with every single patient, first of all, most of them wouldn't believe it. And second of all, I would spend an hour of my time on one individual. It's like, imagine you knew exactly what was going to happen on 9/11, on September 11th, and you were running down the hallways of those Twin Towers saying, you got to get out now, a plane's going to crash into the building, and we have minutes to get out of here. And then people would be like, yeah, sure, right, yeah, you nuts, whatever. You only have a certain amount of time to try to help people, and they are either going to get on board with it or they're not. So what I've done is I have a series of 8 classes, and we're starting it in January. And it's not free, because I used to do free classes, and guess what? People either would commit and didn't show up, or they wouldn't really take the information seriously. And I don't even want to tell you what I paid for this information over the past 25 years. So it's valuable. It's life-changing, every single one. And I'm giving you 8 hours of my time. I know what most doctors bill out at, and a conservative estimate is $400 an hour. That's conservative.
Whoa.
I'm giving you 8 hours of my time semi-private. It is a limited group setting. And you'll also get a technology that can jumpstart the whole process for under $200 starting in January. And if it's not within your means, I'm sorry. But for anybody, most people, if it's important, they can find a way to find $200. And this is a life changer. 8 hours, 8 classes where you will get all the information that you wish your medical doctor would give you, but they just can't. They can't do it. Here's the rub. Those concierge doctors, this information is exactly what you get for them. And they charge $10,000 for that conversation.
Good glory.
You're going to get 8 hours that a concierge doctor would charge you $10,000 for. And if it's worth it to you, if you're in a place where you're ready for change, because you have to be on that hill one way or another.
That's right, you do.
You have to be on that hill, and you have to decide that I'm turning this bike around. And when you're there, we're going to give you the easiest path. I've learned over the past 25 years what it takes to make change in people, and what it takes for them to have the easiest way to do that.
And the the unfortunate part about that, excuse me, is that it doesn't happen overnight.
No, nothing does. But change happens in an instant. It can. Your decision up on the top of that hill was an instant.
It was.
It didn't even
Absolutely.
take overnight. It took a split instant for you to decide that you weren't going to drive over the side. You were going to drive back in and start your life. So change does happen instantaneously.
Yes.
It's getting to that point that people will be dragged kicking and screaming to, even though it's literally going to change and save their lives.
Well, that's true. And we need to take a break, and we'll be back in a moment. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, AM 1220 KHTS. Welcome back to the Senior Hour. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, AM 1220 KHTS. And we've been speaking with Dr. Thomas Polucki, a local chiropractor who doesn't really dabble.
Thank you.
From what we understand now. At least
Yeah.
that's what you've told us.
But you're-
Dabbling is not in your vocabulary.
And dabbling with these 8 classes won't exist. I'm sure there are very highly specific classes that you are going, and information that you are going to be giving to our listeners. And some of that, I think, information they get from the show and from you and your show. But I think to consolidate it for our listeners and our caregivers and people in general, they need to know what this system is doing at this point, and it's not an easy task to challenge it and try to figure it out, to present it in a logical way.
I believe that this is where healthcare is going, not by choice, but by necessity. I believe that you will start seeing conventional medical doctors start adopting these practices, not because they want to, but because they have no choice but to. You will start seeing these group formats where there is the support group, where there is the one professional that is giving the information that is absolutely necessary and critical in the area of nutrition, in the area of exercise, in the area of stress management. And unfortunately, when you start getting into that arena, these talks are going to be at the hospital in the conference room or something like that, and they're going to be brought in from the community, you're under the same kind of situation that the private interaction with the patient is. How is this going to profit the hospital? How are we going to start seeing something from it? Mm-hmm. So I believe that right now this is the format that is going to be most effective for most people.
5 to 10 years down the line.
Well, yeah, but we're doing it now.
We're in a transition of doing this now.
Sure.
And the unfortunate part is that, it really is like reinventing the wheel, or trying to, where we already have a wheel. Mm-hmm. And if you go to other countries, there are models around the world.
Yeah.
And one of the columnists in our local newspaper wrote about how he visited, I think it was a nephew in Holland, and how their system is, and use that as an example and a nice model. But there are other, Taiwan is the same way. The Norwegian countries are the same way. There are systems around the world that work, but injected into our system is, once again, profit and greed. And when you throw those in, then you're extracting out what monies that could be used for medical care. So that's why our gross national product, 17.5% of it, is all on healthcare, whereas around the world, it's less than 10%. Why is that? Because you got the profit motive there. Right. And so when you have that and don't take that out, we're going to transition, like you said, into this arena, which is not going to, in the long run, benefit the American people.
Right.
Can we go back to your group?
Yeah, I'm calling it Activate because I'm limiting it to, first of all, activate, get active, but I'm limiting it to 8 people per class. And the first one is already more than halfway full. There are a couple of spots left for this first pilot group to see what the potential is for this. And again, we're keeping it ridiculously affordable for people. I know $200 sounds like a lot of money, but comparatively that is nothing. For 8 hours of my time joining a support group, getting all the information necessary to really put all the pieces together, that you have a strategy of staying out of trouble in the first place. And I know that isn't where most people think when they think of health. That's quite obvious in this country, and there's a reason that we are programmed to think this way, because around the world, as Dr. Dorio just said, it doesn't really work that way. But here it is that I don't have a problem, I don't have a problem, I don't have a problem, I've got a life or death situation, fix it. And that just is the most expensive and least effective way of dealing with anything.
That's very true. Now, in your group of 8, will you have open discussion also? Or is this just a teacher-student?
No, we won't. You will have the support of the 8 people, and you can talk amongst yourselves as much as possible outside of the group. I give you an hour of my time where I have to disseminate essentially a 24-hour seminar into 1 hour. So you are there to get the pieces of the puzzle. As far as your support group, you are going to form relationships, interactive relationships with the other 7 people in that group that you can pursue it as much or as little as you need to. Part of the benefit of this is the support.
Right. Mm-hmm. But will you have question and answer time? If someone has a question about what you're talking about?
Possibly.
Okay.
The bottom line is we've got to see how that goes. This is the pilot group. And during the portion where I have to give you all of the things that you don't know about, we're real limited into that being a conversation that pretty much has to be a one-way conversation.
So to get into that class, how do our listeners, what number do they call?
The 753-9340 and ask to be put on the Active 8 list.
Wow. Great information, and I'm sure that the A classes will provide so many facts that they need to learn about that'll benefit them in the long run.
Yeah, and they are interactive. I'm sorry, Barbara, I know we're at time. Your question was, is there a question answer period? No, but built into every one of these classes is interaction.
Dr. Thomas
Well,
Polucki, thank you
yes.
so much for being on our show. Happy holidays to everybody and all our listeners. We are sponsored by Advanced Audiology and Comfort Keepers in Home Care. Listen to us next week on the Senior Hour. Now go and enhance your quality of life.